Hi everyone. Now we are going to discuss about pre-anesthetic medication. So what is meant by pre-anesthetic medication? A medication comprising a drug or more drugs chosen appropriately and given preoperatively in an appropriate dose, time and route before an anesthesia so as to have their beneficial effects on the system of the patient preoperatively, intraoperatively and postoperatively. This is essential for the safe conduct of anesthesia. In the current day practice of anesthesia, patient is pre-medicated with a purpose, not as a routine procedure. If given, the pre-medication is given with the following goals. So, the goals of pre-medication are: first one is to relieve anxiety. Second one is to produce hemodynamic stability. Third one is to induce sedation, that is good sleep, and reduce metabolic rate. The fourth one is to provide analgesia and amnesia. The fifth one is to decrease the chances of aspiration. The next to control oral and respiratory secretions, to prevent postoperative nausea and vomiting, and the last one is to control infection. So, the first one is to relieve anxiety. Relieving anxiety is the most important goal in present day anesthesia. Nothing can be more helpful in relieving the anxiety of the patient than pre-operative visit of the anesthetist, clearing the patient's doubts, fears, myth and explaining the anesthetic technique. Benzodiazepines should be used only for the patient where assurance by anesthetist is not sufficient or for pediatric patient. The next one is to produce hemodynamic stability. Clonidine was recommended for hypertensive patient in past but not used nowadays. The next one is to provide analgesia. Opioids are given intravenously just before induction to provide analgesia. The next one is to decrease the chance of aspiration. The best way to reduce the chances of aspiration is by keeping the patient fasting, that is NPO guidelines. Therefore, the drugs for aspiration prophylaxis, that is metoclopramide, antacids and H2 blockers, example ranitidine, should be employed only for patients who are at high risk of aspiration such as hiatus hernia, pregnancy, not routinely for every patient. The next one is to control secretions. Anticholinergics available to control secretions are atropine, glycopyrrolate. Glycopyrrolate is a preferred anticholinergic over atropine because it does not cross the blood-brain barrier. The next one is to prevent nausea and vomiting. Drugs which can be used for antiemetic prophylaxis are ondansetron and metoclopramide. And the last one is to control infection. The timing of antibiotic should be adjusted so that the peak blood levels are achieved at the time of skin incision. Therefore, antibiotic prophylaxis must be given within 60 minutes before skin incision. Thank you.